Hello everyone, Dr. Suresh here. So last time, we absolutely nailed the Class 1 prep. Today, we're upping the ante and tackling the Class 2. The big difference? We're now extending our preparation from the occlusal surface over to a proximal surface. Yeah, it's a bit more complex, but I promise, by the end of this explainer, you'll have a rock-solid framework for this super common procedure. So let's get right into it. Okay, here's our game plan for today. We'll kick things off by looking at what makes a Class 2 so unique. Then, we'll break the whole procedure down into two big phases, the occlusal step and the proximal box. After we've got the how down, we'll dive deep into the why, the core principles of resistance and retention, which are, absolutely crucial for your exams. Then we'll wrap it all up with the final finishing touches. All right, phase 1. You have to think of every Class 2 restoration as a building. And the occlusal step, that's the foundation. Getting this part right isn't just important, it's non-negotiable. It really dictates the strength and stability of the entire filling. So let's start there. We always begin with the punch cut. You're going to grab your No. 245 burr and enter the pit just like we did for a Class 1. Now, the target depth is absolutely critical here. We're aiming for 1.5 to 2 millimeters. This gets you through the enamel and just past the dentino-enamel junction, the DEJ, about 0.2 millimeters into the dentin. That very precise depth is what gives the amalgam the bulk it needs to be strong. So as you're developing this occlusal part, you've really got four main goals. First, establish that outline form, and you want to keep the isthmus, the narrowest part, to less than a quarter of the distance between the cusps. You'll extend just enough to get any carious fissures. Critically, your facial and lingual walls need to have a slight occlusal convergence. That helps lock the filling in place. And finally, you'll create a nice dovetail feature, which keeps the whole restoration from being displaced. Okay, so here's a classic clinical challenge you're going to face. We have to connect our occlusal prep to the proximal box, right? But that marginal ridge is sitting right there. So how in the world do we cut through it without totally weakening the cusp right next to it? Well, this is where some really clever engineering comes into play. And the beautiful solution to that problem is something called the reverse curve. It's this subtle S shape that you carve as the isthmus flows toward the proximal box. Its purpose is purely structural. It lets your preparation wall exit the tooth at a perfect 90-degree angle, all while saving that precious, strong tooth structure in the cusp area. Look at this slide. It shows that 90-degree exit angle perfectly. We call this a butt joint margin, and it's the absolute strongest design for amalgam. Burn this image into your brain, seriously. The reverse curve is a favorite topic on board exams because it proves you understand the biomechanics behind what you're doing. All right, our occlusal foundation is solid. Now we can move on to what is, let's be honest, the most technically demanding part of a Class 2 prep, creating the proximal box. This is where we actually extend our prep down the side of the tooth to get rid of that proximal decay. We kick off the box with what's called a proximal ditch cut. The key here is all about location, location, location. You position your burr right over the DEJ, but, and this is important, you stay inside the walls of the marginal ridge. You're basically creating a deep, narrow trench, moving your burr facially and lingually, but you haven't broken through to the outside of the tooth just yet. Now from that little ditch you just made, you're going to drop the burr gingivally, down towards the gums. This deepens the cut and creates the axial wall, which is the inner wall of our box. The ideal depth for this wall is just into dentin, maybe 0.5 to 0.8 millimeters, and you want it to follow the natural curve of the tooth. Okay, before you go any further, just stop. Here's a clinical tip that is going to save you and your patients a world of hurt. Place a wooden wedge between the teeth. This does two amazing things. It gently separates the teeth a tiny bit, and way more importantly, it protects the neighboring tooth from getting nicked by your burr. For these conservative preps, even a simple round toothpick can work beautifully as a wedge. So now you have this deep box with just a paper-thin shell of enamel left on the outside. You don't even need your burr anymore. You just take a hand instrument like a spoon excavator and gently fracture that weak enamel wall away. Then, you grab something like an enamel hatchet to smooth out the walls and refine all the angles, making sure everything is sharp, clean, and well-defined. Okay, we've just walked through all the how-to steps of the procedure. Now, let's switch gears and talk about the why. Because to really master this stuff and to kill it on your exams, you have to understand the principles of resistance and retention form. This is the theory behind every single cut we just made. If there is one and only one number you remember from this entire explainer, I want it to be this one. 90 degrees. So why is this number so important? Well, amalgam is an interesting material. It's incredibly strong when it has bulk, but it's very brittle and weak in thin sections. A 90-degree cavosurface angle, that's the angle where your prep meets the outside of the tooth, creates a really strong, thick amalgam margin. If you have anything less than that, the edge of your filling is just going to chip and fracture off under chewing forces. Okay, let's break down the first core principle, primary resistance form. The goal here is pretty straightforward. We need to engineer our preparation so that neither the tooth nor the filling will crack under the incredible forces of chewing. And here are the design features that get us there. A flat pulpal floor helps resist those vertical forces. Rounded internal line angles reduce stress hotspots. Keeping the prep narrow conserves cusp strength. We've already talked about how that reverse curve strengthens the whole junction. And of course, that adequate depth gives the amalgam its strength. These are your key exam points for resistance forms, so make sure you know them. Next up, primary retention form. So if resistance is all about preventing fracture, retention is about preventing the filling from getting pulled out or dislodged. Since amalgam isn't actually bonded to the tooth, we have to rely on good old-fashioned mechanical locking. And how do we create that lock? It's primarily through two features. First, that occlusal convergence we mentioned, making the bottom of the prep just a little bit wider than the top. That creates an undercut. And second is the dovetail, which stops the filling from being able to slide out sideways. It's just pure, simple, mechanical engineering. We are in the home stretch now. The main shape is done, but we still have to deal with any leftover decay and really refine those walls to get a perfect, long-lasting restoration. Let's get into the finishing touches. This is such a critical concept. If you find a deep spot of decay on the pulpal floor, you absolutely do not drop the entire floor down to chase it. That would just weaken the whole tooth for no reason. Instead, you keep the ideal floor depth everywhere else and use a slow-speed round burr or a spoon excavator to remove only the infected dentin, creating a little divot. That's what conservative dentistry is all about. And a quick clinical note on secondary retention. Sometimes for really big, wide boxes, you might add some tiny retentive grooves in the internal corners for a little extra lock. But honestly, for most conservative, narrow Class 2 preps, the primary retention we get from the occlusal convergence and the dovetail is more than enough. Don't add features that you don't need. And the very, very last step before you're ready to fill is to finish that gingival margin. You'll take a special hand instrument called a gingival margin trimmer and create a tiny, slight bevel on the enamel right at the floor of the box. What this does is remove any weak, unsupported enamel rods, and that ensures you get the strongest possible seal at this really critical margin. So, we've covered a ton of technical details today, from burr depths to cavosurface angles, but I really want to leave you with this final thought. This isn't just about passing a practical exam or getting a good grade. Every single one of these principles, resistance, retention, being conservative, it's all designed to do one thing: to make your restoration last longer and to better serve your patient. Mastering these fundamentals, that's the foundation of providing quality care. You all did a great job today.